Is your health insurance working for you? This is a short video to learn about resources offered through the Office of Superintendent of Insurance, and this is a state office that provides consumer protection and education and also ensures that insurance companies provide fair rates. To date, the health insurance marketplace in New Mexico has had successes, and these include that for the first 4 enrollment years, New Mexico ranked in the top 4 marketplaces with the lowest rates. For the coming enrollment year, we still rank high in the top 10 for lowest rates. And New Mexico continues to offer more choices to consumers across the state, including rural areas. 4 health insurance companies offer plans statewide, and no other state has had this success. In this video, we're going to cover these 3 areas. So, details about open enrollment for 2018, and this includes a health insurance plan comparison tool, challenges and solutions with health insurance, and OSI resources for consumers. Keep in mind that OSI is the acronym for the Office of Superintendent of Insurance. Now is the time for open enrollment. It's from November 1st to December 15, 2017, and that's for coverage starting in 2018. Financial assistance is available. You can purchase that on BeWellNM, and this is the same as healthcare.gov. Keep in mind that in order to receive financial assistance, you do need to go to BeWellNM to enroll in a health insurance plan. It's also important to note that 72% of New Mexicans qualified for financial assistance last year. You may qualify as well. Here's an example of income ranges from 2016. The numbers in blue are per year, and the numbers in black are per month. So let's look at an example. For a household size of 4, that family could make between $33,600 to $97,200 per year and qualify for assistance to pay for their health insurance coverage. Now, if their income was less than $33,600 per year, they would qualify for coverage through Medicaid. New Mexico has the same insurance companies that will be offering plans this year as last year, and that's New Mexico Health Connections, Molina, Christus, and Blue Cross Blue Shield. OSI has new consumer-friendly tools on their website, and these are the 3 that they have. We'll show you these in a moment: the plan comparison tool, provider directory, and rate review tool. These online tools can be found at this URL. And if you want to get directly to the plan comparison tool, you can also go to this URL. So let's go ahead and take a look at the plan comparison tool through the OSI website main URL. So when you're on the home page, you'll scroll down, and under the header for consumers, you'll click on Health Insurance Tools. And once you're on this page, you can see the 3 different types of tools just mentioned. So that's the rate review website, the provider directory, and then the health plan comparison tool, which is what we're going to look at more closely right now. When you get to the health plan comparison tool, if you'd like some additional information, you can watch a video. We'll go ahead and click continue and get started. So what you're first going to need to do is enter in information about you and or your family. And we'll just enter in information about a hypothetical family of 2. They live in zip code 87901. And we'll say that person number 1 is 45. They're in good health. And let's say that that person, as far as expected medical procedures, would be a hysterectomy in the coming year. This person doesn't use tobacco. They're not a member of a federally recognized tribe, and they are not pregnant, so you wouldn't check those. To add another person, just click there. We'll say the next person is 47 in fair health. This person doesn't expect any medical procedures for the upcoming year. Then the next question is, would you like to find out if you can get help paying for coverage? We'll say that this family does want to find out. So then they just need to do a couple more things. So there's 2 people in the household. Is employer coverage available to everyone in the household? We'll say no. And then as far as this family's expected income in 2018, we'll say $50,000. Then you click here. So for this family of 2, their estimate of the premium tax subsidy for this family would be $675 per month. So you click continue. Next, this family would enter in any doctors that they're interested in having in their plan. Once they've done that, you can see the doctors are listed over here. And we'll click continue. And then this family would also enter in any prescription drugs that they want to be able to use with their health insurance plan. So we just entered in a couple, and we'll click compare plans. And then you can see the plan comparison tool. So it includes a list of the plans, mix of the metals, bronze, gold, silver, the total yearly cost estimate for those, preferred doctors in the plan, the percentage is of nearby doctors in the plan. So for that particular zip code, for this plan, 7% of doctors are in the plan. And you can sort plans by metal level. So say this family wanted to just look at bronze. Click on bronze and then filter results. You can see various bronze plans. But if you decide you don't want that, just uncheck and click on filter. So this family can get an idea of what their monthly premium would be. So for this particular plan, the monthly premium would be $172, and that's after the subsidy. For this bronze plan, the monthly premium would be $0, and that's after that subsidy. The family also can look at the deductible for that particular plan under each of these. And they can also see which prescription drugs are in that plan. So remember that family entered in these 2 types of prescription medications. And for this plan here, you can see that both 2 out of 2 are covered. For this plan, you see that 1 out of 2 are covered, etc. And if you remember, they also entered in a particular doctor that they wanted in the plan. And that's if the doctor is in the health plan's provider network. And so, for example, here's the doctor that they chose. You can see that they're under some of the plans on this list. So to recap, the plan comparison tool gives you an idea of your cost per year for that plan, if financial assistance is available, if your doctor is available under the plan, and if your prescription drugs are available under that plan. We know there are many challenges related to health insurance. Health insurance can be confusing. Here's some types of questions that may come up. What do I do when I'm denied benefits or get an unexpected bill? What financial resources are available to make coverage more affordable? What doctors are in this health plan's networks? What services are covered by this health plan? What do I do when I can't get the services promised by the plan? And why does my coverage cost so much? But there are solutions as well. And we already explored some solutions, which are the online tools. Here's some others. You can provide comments, file complaints, and find resources on the OSI website. On the OSI website, you can participate in a rate review process, and New Mexico has a strong rate review process in place. OSI reviews proposed rates to ensure that they are properly justified from the insurance companies. So they analyze the insurance company's claims experience, and they ensure that rates are transparent and competitive. They also review your comments related to rate increases, and they make sure that increased rates are justified. Rate review lets you share your concerns, which can be complaints and appeals, about your health insurance company with OSI. So during the rate review time period, you can do this on this URL. Outside of that time period, you can contact OSI at this number, or also go to their website for rate review information. This is the time frame for rate review. Each year in April or May, the Superintendent of Insurance reviews health plans. Plan documents and proposed monthly premium rates are made available to consumers to see and to comment on for at least 30 days, and sometimes for a longer period. As you can see, the time is past for that now, but you can be ready to participate in the rate review process in the coming year. If you're interested in filing an appeal with the Office of Superintendent of Insurance, it's important to know how an appeal is different from a complaint. It's more specific than a complaint, and it happens when unfair decisions were made. It relates to a specific denial of coverage, termination of coverage, or wrongful billing of coverage. Here's some examples. Surprise medical bills from providers that you thought were in a network but aren't. For example, you thought your insurance company was going to cover everything, but then you got another bill from a doctor who's out of network. You had a denial of medically necessary medicines or services, or denial of services the plan documents say are covered, or termination of health plan coverage. If you're interested in filing an appeal, you need to make sure to do this first with your insurance company. And here's some tips for filing an appeal. You need to specifically ask to file an appeal on your complaint. You always ask for the name of the individual to whom you spoke or filed an appeal with, and it's important to record the date you spoke with the person. On the OSI website under File Complaint, you would go down to Managed Healthcare Insurance and click on that in order to file a complaint and an appeal. You can fill in the online form, or you can also download and print the form. On this, you're going to explain the details of your situation. You can also upload documents such as bills or letters that you've received related to the problem. You can describe what you think is a fair solution to the problem. And at the end, you're going to receive a confirmation page that shows that you've submitted that information. Be careful of fraud. Fraudulent insurance companies, agents, and brokers are out there, and they're selling fraudulent health insurance. If you see something suspicious, say something, and if it looks too good to be true, it probably is. This is where you can report fraud. So this is the OSI website, and you scroll down to the bottom right and click on where it says Stop Fraud. You would click there. If you need more information about the Office of Superintendent of Insurance and their different resources, you can contact OSI at this number. If you're interested in community presentations related to OSI and their resources, you can also contact Health Action New Mexico at this number.